An ex-colleague of mine died last week, and to see the impact on his current coworkers and the impact from those of us at the Vindy who worked with him, it's been pretty severe. Curious from the doctor's perspective, losing a dear client way too early.
This is it's just extremely frustrating, and I'll tell you specifically why. Throughout the process of aging and disease, there's a certain pattern that we can pretty much predict. This is completely unpredictable. You can have someone who you just saw 5 minutes ago, and we're oxygenating fine, we're breathing comfortably, had oxygen on, their vitals are stable. You turn around, you go to see your next patient, or you just go to the computer to document. Next thing you know, they're coding your patient who you just saw doing perfectly fine because they stopped breathing, or they had a cardiac arrhythmia, or they just plain old passed. You cannot turn around without having a thought as to whether you're going to see that patient again the same way you just saw him 5 minutes ago. And that's brutal. It's just absolutely brutal. That's not just going to work and taking care of your patients and then going home and worrying about them. This is about seeing death smack you in the face from somebody you just saw 10 minutes ago, and they're gone. That's the problem with this. That's a problem. No matter what care you give them, no matter how much time you spend with them, no matter how closely you monitor them, this is from 1 minute to the next, they could be gone, just like that. And there's no clinical predictable pattern that they follow. None. You do not see this coming. You do not see them crashing. You cannot predict who's going to crash and who's not going to crash. As far as you're concerned, every single one of them has the potential to, no matter how good they look right now, every single one of them. And that's how, when you have to work under those circumstances, it is extremely straining for the nursing personnel, for everybody, the respiratory therapists, the doctors, the specialists. I don't care how many people, I don't care how many times people say, we more people die of heart attacks and strokes and cancer. Yeah, for sure, no doubt about it. But these patients have a pattern. This is a bad hide and seek joke that every patient can play on you, and you have no idea if you're ever going to see them again. Now, cancer patients, heart disease, strokes, you treat, some of them survive, some of them do not. But you see it coming, because as soon as they walk in, you treat them as they could die anytime. Yeah. And you do everything you have to do, and you monitor them as closely as you possibly can, and they still drop dead. It doesn't matter. It doesn't matter what you did. It doesn't matter what you're planning on doing. You're responding to something that is completely unpredictable. You don't know when somebody's immune system is going to say, you know what, this is shutting down right now. I can't put up with it. And it kills you. Just like that.